All right, we are live here at the Southern Women's Show in Memphis. Dr. Visha Patel is about to go live. She's speaking on skin through the ages. It's going to be a great talk. I'm going to walk you over to her in just a minute. But check out this booth, guys. I mean, if we could win a prize for banners, we would definitely get gold. There's Dr. Patel. Cool sculpting. Visha Spa. And all the lovely ladies of Advanced Dermatology. Alright, real results. Let's go check out Visha Skincare with Dr. Visha Patel. She's taking the stage. She's ready to talk. If you've ever heard Dr. Patel speak, you know she has a lot of knowledge to throw down. So, stay tuned.
Just to let you know, Dr. Patel is going to be speaking in just a couple of minutes on skincare through the ages, and we're talking about the ages, your 20s, your 30s, your 40s, your 50s, your 60s, and on. So here you hang around, pay attention, I guarantee you'll learn something.
Hi guys, welcome to the Southern Women's Show. We're going to talk a little bit today about skin through the ages. I'm Dr. Visha Patel. My office is Advanced Dermatology and Skin Cancer Associates, and we're located in Germantown, Tennessee, and Olive Branch, and soon to be in Arlington, Tennessee. When we talk about aging and what happens as we start to age, there's so many factors in our life, from birth all the way through. And aging is not just about your skin, it's about your body. Your skin is the largest organ of your body. So you have to understand that all things need to be taken into account, all the way through your teenage years, all the way to the end of life. So when you think about how to take care of your skin, the first things we need to do is talk about how to take care of your body. So what I always tell all my patients, always, is 6 glasses of water, 8 hours of sleep, a multivitamin, and a probiotic. Now those are things that contribute to complete body health. We are born into this world with everything that we need to survive and to help ourselves age gracefully. What we do with our bodies and with the environment that we put our bodies in is what contributes to how we feel, live, and how we look, okay? So when we talk about 6 glasses of water, why is it important? Because our bodies are made out of water and we need that hydration throughout time. As we age, we lose hydration, and so it's not only just to put on moisturizer and to take care of your skin, but it's important to also drink your 6 glasses of water. And if you're like me, coffee doesn't count, but you can add it in if you want. Another thing that we'll talk about is the importance of protecting yourself from the environment. So once again, your skin is your largest organ of the body, and you're going to protect your body and the inside of your body from the outside. The biggest thing we talk about is protecting yourself from the sun. The sun is not our enemy per se, but it's definitely something that we want to protect our skin from, because over time we get photoaging, release of free radicals, increased inflammation in the skin, as well as what we put into our bodies, which can create increased inflammation in our bodies. And that inflammatory process wears down upon us, where we're no longer the bodies and the skin and the people, both physically and mentally, that we were before. So we talk about sunscreen. We talk about our daily regimens, things that we need to do on a daily basis to prevent all these things from happening, and things that now we can do wherever you are in your 20s or your 30s or your 40s or your 50s or your 60s, wherever you are in that, we need to know what we can do at that point in life to either work backwards to help rejuvenate the skin, and to also help rejuvenate our bodies to get us back to where we were so we can live longer and look better too. So in the beginning, when we start all of this, we're just teenagers. And we're in maybe before our 20s, young, invincible, make all the right decisions, no one else is right, we are right all the time. And this is when we need to decide to wash our faces twice a day. That's the biggest thing you can possibly do. Because if you wash your face twice a day, you will prevent yourself from accumulating the dirt and bacteria that can come on our skin, and also help prevent acne, and then acne scarring. So, we are given everything that we need. We shed our skin daily. That gets rid of the bacteria and fungus that's on our skin. We create oil to help rejuvenate the skin. We're born with this wonderful thick collagen that is slowly degraded over time by the sun and the environment. And we, in our 20s, are now able to just do one thing. We want to exfoliate and wash our faces twice a day. And if you can, wear an SPF. An SPF of 30 is so important to use on a daily basis. And you want to do that every morning. Why? Because over time, the ultraviolet radiation from the sun, whether you're getting it through your car window, whether you're getting it from going outside, or even if you're sitting in front of a computer all day long, ultraviolet radiation is going to make the collagen break down. And it does that a lot of ways. But as we get older, we notice that as the collagen starts to sag and it's not as plump anymore, that's when we start to get wrinkles and fine lines and the look of aging. So that's in your 20s. Develop a regimen. If that's all you can do is wash your face twice a day, that would be important. Try to sleep on your back. What a great time in life to try to sleep on your back. How hard is that? If you sleep on your face, your collagen will break down in that way, downwards, forwards. And people who do that will tend to get more aging in that direction. If you sleep on one side, people tend to break down their collagen more on that side than the other, that just by gravity and time. So it's important at that point to just get the right habits on board, washing off your makeup, washing your face twice a day, and developing some form of regimen. If you're seeing a dermatologist at this time in life, or you feel like you're breaking out and having acne in your 20s, that's when you want to look and see what could I be doing that could be causing this. So we'll talk a little bit about acne. 4 things cause acne. That's it, 4 things. First, you have to clog the pore. I usually do a little hand motion here. Once the pore is clogged, that's usually by dirt, sweat, oil, and makeup. You get inflammation because there's a normal amount of bacteria and fungus that lives in our skin. That little micro-infection that you get under the surface of the skin in that little follicle is what creates a pimple. That little bacterial infection or fungal infection grows, creates inflammation that comes under the skin, and then we get a pustule formation from the inflammation. So look at your habits in your 20s. Are we now using products that are kind of slimy, oils in our hair that could be clogging our pores? Are we not washing our faces as much? Are we playing sports and not washing our face before we play sports? What kind of makeup are we using? Are we using primers that are too occluding? Are we not washing those off either? This is the time to look at your regimen because these are the habits. This is the time to wear SPF. These are the habits we're going to need because in the 30s, we're trying to go backwards to build that collagen. Even though 30s is super young, 20s is super young because nobody ever thinks of this in their 20s. But that's when we develop the habits that we really, really need for moving forward. If we can keep our skin clear, free of discoloration, free of scarring, free of photo damage, then we can generally walk into our 30s pretty confidently. What starts to happen? We start to see the damage, right? We start to notice just a couple of freckles, a couple of sunspots, maybe a little crepiness under the eyes, you know, the stigmata of not drinking enough water, being a little dehydrated, not maintaining a balanced diet, maybe too high in carbs or too high in sugar, which are pro-inflammatory foods in the 20s. In the 30s, you start to notice these changes, and maybe not. Some of us are very genetically lucky and they don't have any problems in their 30s. But a lot of us start to notice discoloration and a little bit of crepiness in the skin. There's a couple of things you can do at this point. One of them would be to start using something at night with a retinol, vitamin C, vitamin E, ferulic acid, or something with salicylic acid. And the reason why we use these products or these actives on our skin is because they not only have anti-inflammatory effects, which means they will help not break down the collagen, but also it's going to result in a little bit of skin lightening, decreasing the appearance of pores, and ultimately, if used consistently, will increase collagen production. So your skin, as it's getting sloughed, thinks that it's getting wounded. That seems really mean to do to your skin, but really what you're doing is you're tricking it and making it boost the collagen. You're making it go back to the way it was. So you're helping your skin gain that strength, that black, that plumpness, that elasticity that it had before. And it just starts to happen in the 30s. And that's when people start looking at their dermatologist or start buying creams over the counter. They might start doing things to help with that. Yes, we do have a product called our Visha Skincare Advanced Correcting Serum. It does have your retinol, vitamin C, vitamin E, ferulic acid, and a natural lightening agent in it. And that is something that you can start using in your late 20s and 30s to not only help with the acne and the breakouts, but also help with the discoloration and the scarring that can result. And it's simple to use because it's just twice a day to get all the results people need. Exfoliation, like we talked about, really important. Trick the skin into thinking that it's damaged so that the collagen can produce itself, and so it looks fitter. People start to get ingrown hairs as well, and part of the exfoliation is what kind of cleanser are you using. So at this point we need to figure out, are we oily? Are we dry? Do we have sensitive skin? Does something in particular break us out? At this point, we usually know in our 30s where our skin is heading, and the majority of us tend to have what we call combination skin. Combination skin would be when we have a T-zone, mostly oily forehead, nose, and chin, mostly dry underneath the eyes and the sides of our cheeks. And we need to be aware of this. We need to know what we're going to do, because if you start putting a product all over your face that's going to be too drying in some areas and dry out the rest of your areas, you could be causing more damage than good in the long run as you go on this journey to try to combat the aging process. Don't forget, through all of this in your 30s, you're still going to be drinking 6 glasses of water, getting 8 hours of sleep, taking a multivitamin, and getting a probiotic. Why a probiotic? A probiotic is natural gut bacteria that we eat. So at this point in life, we've had enough antibiotics that have depleted our gut of the bacteria that needs to be there. And that creates inflammation. The skin's the largest organ of the body, largest immune organ of the body because it's exposed to the outside. And your gut is the second largest immune organ of the body because it's exposed to everything that you take in on the inside. And there's lots of mileage going on in there. So, high carb diets, unhealthy food, not enough water, not getting the right bacteria in your gut can create that inflammatory response, which ultimately just doesn't make you look bad, but creates like heart disease, thyroid disease, and autoimmune disease. So we're really talking about things that are good for you in the long run, not just for your skin. People in their 30s start to get chemical peels. Chemical peels are when we put light fruit acids on the skin to help with exfoliation. That gets rid of your sunspots. That also helps rejuvenate your collagen and can help with acne and scarring. Microneedling can be done in your 30s as well. Microneedling uses a device with tiny little needles. It seems kind of barbaric, that poke little holes in your skin as the needling is done. And what that does is it tricks the collagen into thinking that it's being wounded and creates more collagen, but also creates microchannels for your products. For example, we do microneedling with the Visha Skincare Serums and products, and our cleanser in particular has a high acid content, which helps with exfoliation and boosts collagen production, and it's excellent at reducing acne and folliculitis in men, the shave bumps men get, and help lighten those up. So, in your 30s, microneedling is very popular. We incorporate the serum. Now is when you want to use your vitamin C, your vitamin E, your ferulic acid, your retinol, and you want to use it in a form that's going to get absorbed. So that's what, you might ask, what's the difference between a serum and a cream and a lotion and an ointment? How do I know what to get? Why does it have to be thick? Does it matter what it feels like? What order do I put all this stuff on? Make it as simple as possible because you have to be compliant. These habits you're going to carry on for the rest of your life. A serum is something that's going to be absorbed into your skin very quickly. It gives you your active ingredients. You wash your face, the serum goes on first. That gives you your antioxidants, just like the Visha Advanced Correcting Serum and the Visha Mommy Brightener. That's something that you'll be using then. In your 30s, maybe not so much, but used to be that in your 30s, that's when people start having babies. And so we have our Mommy Brightener. Melasma, or the mask of pregnancy, is extremely common during pregnancy. Not only because of pregnancy, but also through the use of birth control pills and getting sun. Our pigment-producing cells in the skin are not evenly distributed by nature. So when we get sunlight, some people will get discoloration. Some of those pigment-producing cells will become bigger than the other ones, resulting in sunspots or melasma. So people without a lot of melanin will get sunspots, they'll get brown spots. And people like me, who have a lot of melanin, I'll get dark spots after I get red spots. That's my way of scarring, and that's created by the sun. And so, lots of different reasons why people want a product that's going to help with discoloration. But ultimately, helping with that discoloration results in rejuvenation. It results in the appearance of people looking younger, because they're going to have less sunspots, less scarring, and overall they're going to have a more even skin tone. And that's what's ultimately what people want. People like using an eye cream in their 30s because they've abused their bodies in their 20s maybe. They weren't so hydrated. An eye cream or an eye booster, like the Advanced Eye Booster, is very helpful because we can get products that result in 20% reduction in fine lines and wrinkles and puffiness around the eyes in less than 6 minutes. So we can tighten the bags around our eyes. This is the laxity that starts to happen. One of the biggest reasons why we start to look older starting in our 30s is we start to lose fat in our faces. The orbital fat pad, that little pocket of fat underneath our tear troughs, starts to dissipate in our 30s, goes away, and our collagen starts to get more lax. So those two things result in a very important thing that happens in our 40s, jowling. People start to get laxity here, increasing what we call nasolabial folds, these smile lines. They start to notice increase in crepiness and lines around their eyes. We call those, it's not such a nice term, but it's called crow's feet. We start to get lines underneath our lips and around our mouth. That might start to happen around in your 30s. If you smoke, for example, that's very, 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 very bad. And that can result in increased photoaging, more free radical release, decreased circulation to your skin, and that'll result in more aging, ultimately. So people who smoke tend to get lines around their mouth as well, around their lips. And then we call these marionette lines, not also a very nice term, but people in their 40s start to get marionette lines and then the crow's feet. There's also a phenomenon called the 11s. So we have muscles in our face that are working all the time. It's like crumpling up a piece of paper and then trying to flatten it out, and then crumpling up a piece of paper and trying to flatten it out all the time. That's what happens when our muscles are moving in our face all the time. We're frowning, we're creating what we call 11s. We've got 5 muscles that are pushing on the skin here. And over time, we start to get dominant lines in the forehead area. Those are called 11s. And that's how we get our crow's feet, from squinting, maybe not wearing sunglasses when we're outside, and also from just talking and the gelling that happens with loss of facial fat and decrease of collagen. We get those marionette lines and nasolabial folds. In our neck area, we're getting a very, very, very common phenomenon now called tech neck. We are on our electronic devices all the time. And so what we're doing, besides bumping into each other and not looking where we're going, is looking down. People are getting dominant creases in their submental fat and in their neck area. And that's a direct correlation to how our lifestyles have changed from looking at people and talking to not looking at people and texting. So here you've got a change in what's happening to facial architecture. There's a couple of different things. People start to do this in their 30s, believe it or not, because they start using their cell phones when they're 10. And what happens is here we have a procedure called Ultherapy, an ultrasound tightening device that actually can measure, using an ultrasound, the same machine you use when a baby lady's having a baby. We can look and see where the fascia is and use heat to increase the collagen and tighten the neck area and under the neck area. And it's getting more and more common because we're no longer making eye contact with each other, even when we're sitting at the same table. So that happens in your 30s and 40s. 40s, people start going to their dermatologist. Hopefully they go to a dermatologist. Someone who knows skin and knows what to do to make it better. And here's where we start talking about things that they can do to look younger. Many things. People, you might not know what the difference is between different neurotoxins, but the most common one you might hear of is something called Botox. Now, Botox is botulism toxin. It's specifically something that's been dilated, a toxin that's been diluted down to such a minuscule level that's injected into the muscles to prevent movement. So people use Botox for lots of areas. Most commonly it's used for these 11s or the frown lines, 5 little injections to the forehead to prevent your forehead from making those lines. When you get Botox done right away, you don't get results right away. That muscle has to atrophy. You have to not be able to use that muscle so it becomes skinny. Just like when you don't use a muscle for a long period of time, it becomes weak. That's when those lines start to flatten. People also use that toxin around their crow's feet area. Now I say neurotoxin because there's lots of different toxins on the market. There's Botox, there's Yeoman, and there's Dysport. They're all essentially the same kind of thing. They're marketed very differently by different companies, and they're marketed very differently by the injectors. But essentially these are neurotoxins that are injected into muscle to prevent the ability to move muscle. If you can't move the muscle, you can't create those lines, you can't crumple up the piece of paper, so you don't see the lines in the piece of paper, so you don't get the lines when you look at the person. That's what that's about. It's also used here to prevent people from frowning. People might know what RBF is, but it helps with that. And it's also used here in your platysmal bands for people who tend to have very strong necklines from straining or tightening their jaw muscles a lot. They can get accentuation in their platysmal bands. An injection of neurotoxin or Botox is put into the muscle by a dermatologist or a licensed professional who's trained on it. And it results in paralysis of that muscle, resulting in the results that are needed. The results last 3 to 4 months. That's why it's a continual procedure. Another thing people do in their 40s is talk about fillers. Now, fillers are products that are injected into the skin or under the skin to give back facial volume. So we talked about what happens as we age. We get loss of facial fat, jowling, and increased lines or accentuation of the lines, not just of our tear troughs, but our nasolabial folds and marionette lines. Filler is placed there to give back facial volume. Fillers come in lots and lots and lots of different flavors. They can be injected a little bit. Hyaluronic acid fillers, for example, most common names would be Juvederm, Restylane, Hydrel, Belotero, Perlane. Those are fillers that are used that are made out of water. The active ingredient is water. One of the important rejuvenating water-binding molecules that we have in our skin that we're born with, that's wonderful, is hyaluronic acid. We're born with a lovely amount of hyaluronic acid. And that's why it's so important to drink your 6 glasses of water to help that hyaluronic acid. It's a water-binding molecule. Now, there's an enzyme in our skin and in our body called hyaluronase. Hyaluronic acid is also in our joints, in our knees. And we do injections of that in our knees as well for people who have arthritis. So it's very important to drink 6 glasses of water. I cannot express how important it is to stay hydrated. These water-binding molecules are injected into tear troughs to help with tired-looking eyes, bring the cheeks back up. It's injected under the brows to help with the shape of the brow. Your nasolabial folds, these folds here, it can be used for contouring, and I suppose most comically in most movies and in media, it's injected into lips. So people like to parody that because hyaluronic acid can be used to make lips look bigger. The next type of filler available in the market is a longer-acting hyaluronic acid as well. There are 2 different varieties that now last, instead of 6 to 8 months, almost a year. Another type of filler is Radiesse. Radiesse is calcium hydroxyapatite crystals. That is artificial crushed up bone. That product lasts about 12 to 18 months under the skin, injected in the same areas except for the lips, and can give you results. It's also indicated for injection into hands to help with hand rejuvenation as well. The next filler available on the market is Sculptra. Sculptra is a product that is artificial crushed up suture, like absorbable suture material. It's powder. It's reconstituted over time, and it tells your body to attach its own collagen to the product. That product lasts 2 years under the skin and can result in marked rejuvenation and filling of the facial area. That product was originally discovered because we used to use it medically in patients with HIV who had HIV wasting of their face, and now we use it for cosmetic purposes. The last filler that's available on the market, I shouldn't say the last filler, there's a new one as well. Another filler that's available on the market is Belafil, or Artifil, permanent filler. Permanent microbeads wrapped in collagen. Collagen dissipates over 6 to 8 months. Takes your collagen and puts it upon the beads, and that stays where it's supposed to stay over time. That product's also being indicated for acne scars and ice pick scarring of the face as well. So that's a beautiful product. And they say it's now indicated for 5 years because we still continue to age around the product. Lastly, there's a new one called Alafil. It's made up of fat, harvested fat, and stem cells. And that's the newest filler available on the market. And we're still doing research on that to see how it's working out since it's so new. So that's fillers. When you go to the dermatology office, we still do microneedling. But we do microneedling at this point in life, in our 40s, because we want our products to work better. We can do a microneedling device at home. You can do a micro roller. You can do something to get your serum into your skin. You would use a good acid cleanser, of course. And if you're nursing or pregnant or have sensitive skin, you can use the mommy products from Visha Skincare. But you still want the serums to absorb. At this point, we want the maximum effects because we're trying to undo the sun damage and the sunspots. And at this time in life, you're probably going to get the maximum amount of results as well. Ultherapy can be done then as well. Sometimes people don't have levens, but they start to notice a lot of sagging and crepiness around their eyes. Ultherapy using the ultrasound tightening device can be used there for the crow's feet and also for the forehead area for people who don't want to get injections and would like to do something that's going to result in a permanent difference. In our 50s, we not only are on a good facial regimen at this point, we're definitely using sunscreen every morning, an SPF of 30. We're definitely using our retinol, vitamin C, vitamin E, ferulic acid, and the natural landing agent at night. We definitely use our eye creams as well, but we're also looking to see what else we can do to tighten and lift. So we're being a little bit more aggressive with the fillers. We might be doing combination fillers. We're using Sculptra in combination with the Radiesse and the hyaluronic acids. We might be mixing a couple of the fillers together. There's PRP as well. PRP is plasma-rich protein. We actually extract the patient's blood, spin it down, and take all those platelets and plasma-rich cells and put them back in. So we're putting your growth vectors back in your face from what we've just taken out. Now you might have heard of this because Kylie Jenner and a lot of famous people do the vampire facials and the PRP and the vampire injections and all this. That's what that's all about, is we have to take the blood to get those stem cells and those growth factors out of the patient's own blood to put it back in. That increased fibroblasts, it increased tightening, and it also helps with rejuvenation as well. So we get a little bit more aggressive as time progresses. A CO2 laser, a Fraxel laser, is something we generally talk about in the 40s and 50s because we have a significant amount of crepiness and loss of elastin and collagen. And there's just so much fillers can give you back facial volume. But we also have to now combat the loss of collagen, which results in the lines maybe around the mouth, fine lines and wrinkles, the scars, and the laxity that we're seeing, or the crepiness or looseness of the skin. A CO2 laser, a Fraxel laser, uses CO2 to poke little micro holes in the skin. we are targeting water in our skin cells there, and we're creating wounds. That wounding, those little holes going into the micro holes of the skin, is controlled wound healing. We are controlling the way that we will heal from the inside out, resulting in resurfacing. You can have a wrinkly surface, and then we poke little holes and it heals, you have a flat surface. And that's very helpful for crepiness, fine lines, and wrinkles, and also boosting the collagen production. We can do, some people notice that their brows tend to drop around then too. The eyebrow or the arch of the brow or the redundancy of the skin can drop. People start to lose their eyebrows as well. At that point, we can do dermaplaning or tattoo their brows back in for a little bit of help. And you might also start to notice that you're losing hair. So we've lost estrogen as time has progressed. And estrogen is extremely important for youth and rejuvenation. It also helps with moisture in the skin. And it also helps prevent fine lines and wrinkles. Once we lose estrogen in our bodies, we lose estrogen in our skin, it stops fighting with the testosterone receptors in our hair. So women will start to get diffuse thinning of their hair, what we call female pattern hair loss, because we no longer have the estrogen fighting with the testosterone there, and we start losing hair because the testosterone is taking over. Definitely a time to see a dermatologist to see what we can do. Definitely a time we can talk about different things to grow hair. One of the most common causes of hair loss is a low ferritin level and thyroid disease. So most people go to see their doctor once a year, and they'll know whether they have a low thyroid or not, but that can definitely affect your hair. Diet affects your hair. Diet affects your hair. What you eat is what you will look like. And that is how it is through your body, all the way through your life. So that's why it's so important to eat a balanced diet, 6 glasses of water, 8 hours of sleep, a multivitamin, and a probiotic. Ferritin is important because women in their 30s and 40s will have gone through their whole life having heavy periods, and they're a little anemic. And so the iron level is important there. So if you're losing hair, check with your doctor about your iron level and your ferritin level. Definitely check your thyroid and see what's going on. Because if you're overall not healthy, your hair won't be healthy. Your hair is dead. These are dead cells. It's coming out of a live follicle. And that's what's going to make a difference, is creating a healthy bed for that. PRP can be used here as well. So PRP, that thing that everybody was like, what? You're going to draw my blood and put it back in? Yes. PRP can be used here as well. We draw your blood, take out the platelets, take out the plasma-rich protein. We can inject it back in the scalp too. That results in growth factors. That helps the hair grow back. It's basically like fertilizing a barren lawn to get the hair to come back. And that's very helpful. We can do neograft. Neograft is direct hair transplant as well. 50s, we're at our 50s, same kind of problems. Now we have more things that we can do. We have more things to bring you back. It's obviously always helpful if we've developed all the right habits and are not trying to reverse the time clock too much. But there are things we can do in our 50s which just would result in more products and more procedures, and of course using a good skincare line, of course, like the Visha skincare. 60s, we might be talking about surgery. This is when our eyelids get so heavy that sometimes they overlap and we see our eyelids. And that would result in a blepharoplasty. Sometimes we have difficulty, resulting in the sagging of the neck. One thing I didn't mention is there is another product available now for submental fat, because it's not just always that we could be overweight or that we're not eating healthy. Sometimes some people, myself included, have a genetic predisposition to accumulate fat in the submental area. That's super genetic, and sometimes there's nothing we can do about it, the double chin. But now we have Kybella. Kybella is deoxycholic acid. It is an acid, an enzyme that we actually release in our bodies to dilute fat. It's a bile acid. And it's now indicated for injection into the submental area. So these injections, when put into the fat underneath the chin, burst the fat cells and make those cells go away. And so that's another new thing that we have. We don't always have to do just Ulthera for the technique and for the tightening. The Kybella is very, very helpful for that, and we have information on that as well. So we talk about in our 60s, if somebody even wants it, or if they want to continue down the path and they're fighting the aging process, there are procedures we can do in our 60s and 70s to move backwards. If we start early though, like I said, going back to sunscreen on a daily basis, 6 glasses of water, 8 hours of sleep, a multivitamin, and a probiotic, that's the most important thing for photoaging. The next most important thing I would say, that may or may not have anything to do with photoaging, is know what your moles look like. Wear your sunscreen and monitor yourself. What you're going to look for when you look for things like skin cancer are changing moles. A, B, C, D is a melanoma. A is a mole is asymmetric, means not symmetric. B, border, meaning it has an irregular border. C, color, anything more than 2 colors darker than the rest. And D is diameter, anything bigger than a pencil eraser. There's an E in there. E means evolving. A lot of basal cell skin cancers are pink spots that bleed a lot and they don't heal. And D's, and there's a U, I suppose. They say ugly duckling, a mole that's like badder than all the other ones you got. That's when you want to go see a dermatologist to make sure that nothing else is changing. So we talked a little bit about skin through the ages, and we talked about what we do now affects us always throughout the ages. And then we talked about what we can do later to help prevent some of the things or reverse some of the things. If you work on your skin now, you'll prevent the photoaging process. But also, if you're at the point in any of those decades that we talked about, we can also move backwards by using the right products and visiting your dermatologist and getting help. So I hope this was helpful today to you. We went through the generational changes. I hope this was helpful to everybody else that was listening. And let's work together. Let's make our changes together, and let's work with each other and all get better. Thanks.